that it is something that can happen in life. You know, nothing is a guarantee, but you know, this is our life and this is our experience. We're living through it. We're taking it one day at a time. There's some days that I'm angry and I'm bitter, and you know, I go to work. My job is to scan pregnant women every day, all day. You know, it's tough to cope with that, and like, why am I not pregnant right now? You know, why did this have to happen? But you know, there's a lot of circumstances that could be worse. You know, there's always situations that could be worse, and you know, we could have ended up having a baby that had a lot of, you know, chromosomal abnormalities or something seriously wrong, and to have to grieve in that way would also be difficult. I mean, there's many situations that can be so incredibly difficult, especially carrying a child, you know, until you're 9 months pregnant and delivering a stillborn. I can't even imagine after bonding with a baby for 9 months and losing your child when, you know, this happened to me over the course of a few days, and it was still devastating. So, you know, it's just really tough, and you just have to kind of hold on to your faith and trust that. I always say that everything happens for a reason, and I do have a faith in God, and I do have a faith that He's in control. And it's really easy to be angry and bitter and say, like, why did you let this happen to me? And why couldn't I just have a healthy pregnancy? If you allowed me, God, to get pregnant, then why didn't you allow me to just continue the pregnancy and have a healthy baby? Like, why did this happen? But the question of why is really not going to, you know, knowing why is not gonna make the loss any less significant. So I kind of have to just take it day by day and, you know, be thankful that it did happen. It was a miracle. Kyle and I didn't think we could ever get pregnant without treatment, and it happened. And, you know, on the one hand, I kind of feel like this is more of a reason to get into a fertility clinic and make sure that we're monitored and make sure that, you know, that we have the best chance possible of conceiving, you know, a healthy baby. And maybe this is more of a reason to continue with treatment versus just leaving it up in the air of whether or not I get pregnant again. But it's scary, and I feel like I don't know if I'm ready to go through the emotions again and the worrying. And the thing is, you can't worry because worrying isn't going to change it, and whatever is meant to happen is going to happen. So I'm just trying to have faith and trust and, you know, just heal from this, and having hope that one day Karis is going to have a little brother or sister, and even if she doesn't, then that's okay too, because, you know, I have a beautiful, healthy, amazing little girl, and I really couldn't ask for more than that, and I'm very, very blessed. So, you know, I do have a desire to be a mom again and to have another child and to give Karis a sibling, and I don't know if that is meant to be, but I just have hope that it will happen, and if it doesn't, then I have faith that that will be okay too, and I'll just be the best mom that I can possibly be to that little girl, and, you know, give her everything I have every single day. And we're really sad, but, you know, this is where we're at right now. So there will be no pregnancy vlogs, obviously, for now, but we are not sure when we're gonna go to the fertility clinic, the doctor said because of what happened that I don't have to go through all the, you know, standardized testing and classes and mandatory this and that before they'll even wait months to get into the clinic. She gave us her number and said that when we're ready to just call her and she'll put us directly in the clinic and we can start trying again. And I don't know when that'll be. I don't know if it'll be sooner than later. We haven't really decided yet, but she said to give it a good 6 weeks at least. It's only been 2 weeks, so it'll be at least another month before we even consider being seen in the clinic. So until then, we're just trying to get, you know, life back to normal and get into a good mindset that, which is where we can heal and just accept what happened and kind of move forward. You know, I don't want to move forward with another pregnancy or anything with bitterness in my heart or anger or, you know, I'm always going to have sadness over this. I know that that's something I'll always live with, and when I think back on it, I will be sad for the baby that we lost, but I know that should there be another child in our future, whenever I meet that child, it'll make sense to me then, you know, that this is, you know, the child that we were meant to have, and if we're not meant to have another child, then, you know, that's just something that we're gonna have to accept. And whether we think about adoption or something like that, I don't know, but our options are open and we're just kind of healing, and we're planning a kind of just like a little mini vacation here in another couple weeks. Kyle and I are coming up on our 5-year anniversary of us, you know, just being together when we started dating, and our 5-year wedding anniversary will be in October. But I think we're just gonna kind of take a weekend and have a good friend who's gonna probably keep Karis for the weekend, and Kyle and I are gonna go snowboarding a few hours away, and you know, just kind of enjoy having a weekend together and just take that time to ourselves, and that'll be nice. So that's really where we're at for right now. And you know, Karis is doing great. She's napping right now. She's learned to open doors, so we're kind of like getting her into the training of, just because you know how to get up and open the door and come downstairs doesn't mean you get to every time we put you down for a nap or go to bed. So, you know, she's testing the limits, and she's done it a couple times, but I think that she's getting to the understanding. We don't ever have to put her back in her room more than once before she kind of just lays down and goes to sleep. She knows. You know, we're not just going to be like, okay, you can stay up now because you left your room, but me and Kyle have to kind of hide our faces because we want to like smile and laugh at her because it's so cute. She comes downstairs and comes walking in our room and crawls into bed with us, and we're like, yeah, we know you're a big girl now, but you still have to take your naps and you still have to go to bed at a decent time. So that's been interesting to deal with. She's just getting so big. It's crazy how time flies. In a couple more months she'll be 2 years old. So we're just enjoying her and all the wonderfulness it is to watch your child grow and learn new things, and we love her so much, and we're just so thankful to have her in our life. And yeah, so, you know, it's taken me a while to come around to making this video. Didn't want to sit here and hysterically cry through the whole thing, although, you know, I do have to choke back tears a little bit sometimes when I really let myself go there. I think I've kind of learned how to be able to talk and express my emotions and kind of just separate, the facts and the facts from the feelings, I guess, because with my job, I can't be sitting there scanning someone and thinking about how, how come their pregnancy is, so perfect, and how come I'm no longer pregnant, or if I was still pregnant, my due date would be, a couple months after theirs, or whatever thoughts that kind of pop in my head. I just kind of have to push it out and say, you know what, don't think about that, just, you love your job, and, just do your job and be happy to do your job and treat people with kindness and compassion. And if anything, in the future, there has been times on my job where I've had to tell patients that they've lost a child, and, if anything, it just gives me a greater understanding of that type of sorrow. And, although I've always feel like I have been compassionate to those kinds of situations, I just feel like now it's at a whole new level, having gone through a loss and experiencing a loss like that. So anyway, so other than that, we're just kind of moving forward, and we do plan to start fertility treatment sometime in the future. We just don't know when yet, but when that happens, I will definitely let you guys know, and I plan on documenting our cycles and stuff like that. So alright guys, thanks for watching, and thanks for being a part of our journey and supporting us, and I hope everyone's doing well out in YouTube world, and we will keep you updated. Thanks for watching, guys. Bye.